And we are live for open session.
I'd like to welcome everyone to our electronic Board of Health meeting. Due to COVID-19 pandemic, regional councillors practicing physical distancing and councillors are participating electronically. First order of business is the COVID-19 verbal update, and I would turn the floor over to Dr. Wong. Welcome, Dr. Wong, and we're anxious to hear what you have to say.
Thank you, Chair Redmond. I'll just ask if Kathy Prosh could project my slides. So if you could go, Kathy, to the next slide, the first slide, yes. So I will start with update on COVID-19 situation. So there has been a resurgence of new infections following the holidays. This is a situation across many areas in Ontario. As of January 4th, 20 out of 34 health units, or health unit areas, I should say, experienced their highest rate of cases per 100,000 population per week ever in the pandemic. 17 health unit areas have passed a rate of 100 cases per 100,000 per week, and 5 have passed 200 per 100,000 per week. The number of active infections and hospitalizations in the province have also reached pandemic highs. As of January the 5th, Waterloo Region's rate was currently 128 per 100,000 per week, and Ontario's at the time was 154 per 100,000 per week. Locally, we continue to see high numbers of new cases every day, with multiple outbreaks in workplaces and congregate care settings being declared daily, and continual hospitalizations, ICU admissions, and sadly deaths. There is widespread transmission of COVID-19 in Waterloo Region, and like most of Ontario, our rates have never been higher. This continues to put our healthcare system under significant strain, and we know that in the weeks following a surge of cases, we will see delayed indicators increase, such as number of hospitalizations, ICU admissions, and deaths. Therefore, we need to be and continue to need to be under lockdown measures. If you could go to the next slide, Kathy, thank you. So workplace outbreaks are among the most frequent outbreaks in the region as well as Ontario. This graph here shows the most common workplace outbreaks in Waterloo Region since the start of the pandemic. Workplace outbreaks span the gamut of industries and sectors, with most occurring in the following industries: manufacturing, industrial, food and beverage services, sport and fitness settings, food processing workplaces, trades and related services, and construction. The number of workplace outbreaks do not tell the whole story, however. In addition to the number of workplace outbreaks, there are many more instances of workplace exposures. For example, on January the 5th, we had 10 workplace outbreaks, but there were a total of 145 workplaces where at least one employee had tested positive, 75 of which have 2 or more employees who have tested positive. This is reflective of COVID-19 being widespread in our community and therefore being commonly detected among people who work. So the number of workplace outbreaks has significantly increased in the second wave, in particular since November, when our numbers started to surge. About 85% of workplace outbreaks in the pandemic have occurred in the months of November and December 2020. In Ontario, workplace outbreaks were the second highest source of outbreaks, accounting for 31% of all outbreaks in Ontario for the period up to December 26. If you could go to the next slide, please. So the rise in workplace outbreaks has highlighted an important need for paid sick leave. So a few points. One, despite public health requirements, paid sick time is not available for many employees, and people without paid sick time may be less likely to self-isolate. Public health guidance requires people to self-isolate for a minimum of 10 days when they have COVID-19 and 14 days when they are a close contact of a case. In 2016, over one half of Canadian workers said they did not have paid sick days. Almost 3/4 of workers in the lowest income group said the same. Studies from H1N1 pandemic show that people without paid sick leave are likely to attend work. Two, research suggests that paid sick time can reduce the spread of illness in the workplace, among other public health benefits. Lessons from the H1N1 pandemic suggest that paid sick days may be effective in reducing the spread of infectious diseases in the workplace. One study found the availability of paid sick leave reduced H1N1 infection in the workplace by 20%. Another found a higher incidence of influenza-like illness in workplaces that did not have paid sick leave. Adequate paid sick time has been associated with an increase in uptake of influenza vaccination, which could make it a significant facilitating factor in Ontario and Waterloo region as we work to roll out COVID-19 vaccines. And three, those most impacted by illness like COVID-19, such as workers with low income who are disproportionately affected by this infection, may not be able to afford to stay home when sick or when they need to self-isolate. Similar to other influenza-like illness, data shows that COVID-19 disproportionately affects people living in low income. In Waterloo region, 26% of COVID-19 cases between July 17th and October 21st reported a household income of less than $30,000, whereas only 8.9% of the total population reported the same in the 2016 census. Workers with lower household incomes are unlikely to be able to afford staying home for the minimum of 10 days when they are sick or 14 days when they are close contact of a case, considering nearly half of Canadians feel they are always just one or two missed paychecks away from being poor. You go to the last slide, Kathy. Thank you. So in closing, COVID-19 is widespread in our community and across Ontario. One of the key points I'd like to emphasize is that while the provincial shutdown is necessary, we cannot rely on the shutdown measures alone. We all each have a role to play. By staying home, avoiding social gatherings outside the home that we make, we are protecting family, friends, and neighbors. If we do not give the virus the ability to easily transmit from person to person, we will start to slow the spread of COVID-19 in our community. We need to do this in order to make the most of the provincial shutdown. And the other thing that I'd like to emphasize is that the rise in workplace exposures and workplace outbreaks highlights the important need for paid sick time. People without paid sick time may be less likely to self-isolate. Paid sick time can reduce the spread of illness in the workplace, and workers with low income who are disproportionately affected by COVID-19 also face the greatest financial hardships when required to self-isolate. Thank you, I'd be happy to take any questions.
So thank you. A few questions, and subsequent to this, Councillor Vrbanovic and Councillor Lawrence will be introducing a motion about sick leave, paid sick leave. Councillor Jowett, go ahead. You have the floor.
Thank you, Chair Redmond. I just wanted to, I think Dr. Wong knows what I'm probably going to do. Just want to clarify, because this is a public meeting and we are having the discussion about the spread of COVID through employees. And I noticed that restaurants, again, were on the list. And I just want to ensure that we're clear with the public that and also for the benefit of businesses who are trying to survive on curbside pickup food distribution, that we confirm that it's employee to employee transmission and not a transmission from employees to patrons, please.
Dr. Wong?
Sorry, yes. Thanks for the question, Councillor Jowett. I can confirm that we continue to see that by far, the vast majority of time what we see is outbreaks caused by employee to employee transmission, usually in employee-only areas. And it's extremely rare to see employee to patron transmission. And that's because of a lot of the many measures that businesses have put in place to try and ensure that their patrons are well protected.
Thanks so much for that, Dr. Wong.
Thank you. Councillor Kiefer, go ahead.
Thank you, Madam Chair. Dr. Wong, I want to talk about vaccines, and perhaps you may not have this information, but is there any update in terms of more companies outside of Pfizer and Moderna coming onto the scene, like Johnson & Johnson, for instance, or others that you may know? Just wondering if you could comment on that. And then the second question I have is, is there really a problem from the provincial government in terms of distribution? We're hearing all kinds of things and mixed messages with regards to distribution of the vaccine. So if you could comment on those two questions.
Well, for sure, Councillor Kiefer. So yes, there are a lot of vaccines that are in the pipeline in terms of development, and when they're done the necessary trials that they have to go through to show that they're effective and safe, then they apply to regulators like Health Canada to seek approval to distribute their vaccine in Canada. So right now, the only two vaccines that have been approved are the Pfizer vaccine and the Moderna vaccine. But there are others, that are in the process of completing trials or seeking regulatory approval. So there is a good pipeline in the works for potential additional vaccines that could come onto the Canadian market. In terms of distribution, we always knew that there would be limited supply, and in the initial phases, very limited supply, and then as time went on, more and more supply. So in terms of our experience in Waterloo region, we have been receiving what we have been expecting. So the process here, has been rolling out as we had expected. And, that's also why there are the provincial requirements in terms of the priority groups that local areas need to target in order to try to make sure that the limited amounts that we have initially go to those that are most in need of it first. That said, again, this is the beginning of the rollout of the vaccine, and the expectation is that as we go along, there will be more and more doses available. And so, we have no information so far that makes us think there are issues with that planned distribution and increase over time. And so, we're just, for now, continuing to immunize as many people as we can with the doses that we are allocated.
Thank you, Dr. Wong. I appreciate that.
Councillor Strickland, go ahead.
Thank you very much, Madam Chair, and thanks for the update, Dr. Wong. I am fully supportive of any initiative to improve the availability of sick leave benefit for people who are affected by COVID-19 for sure. So I'll give my support to that resolution. But what I have an observation that I'd like to get your comments on, Dr. Wong, and that is I understand the messaging, stay at home, keep your bubble small. But from your charts here today, much of the spread is happening in workplaces. So it is mixed messaging, and I know much of this is dictated by the province, but it's stay at home, essential trips only, keep your bubble small, but go to work. And by the way, for most of the economy, go to work, except for restaurants, hospitality, and so on, and some retail. And so it's a mixed message. Keep your bubble small, but still go to work. So what are we doing based on your graphs, and what is the province doing to contain the spread of COVID-19 in workplaces that remain open during the shutdown?
Dr. Wong?
Yes, thanks for your question, Councillor Strickland. Yes, for sure, the government has made decisions in terms of what it deems essential and that it thinks it needs to allow to remain open while other things should be closed. In terms of, it's a province-wide issue as well as a local issue. And, the key thing that we do in terms of workplace exposures and workplace outbreaks is both, preventative as well as reactive. So preventative, we try to make sure that businesses, workers understand the steps that they can take in order to try to reduce the spread of infection in their workplaces. With the education, with the resources that we distribute via our business community channels. The other is really case and contact management and outbreak management. So as I mentioned, there are usually, recently, let's say there's been about 140 to 60 workplaces at any one time with at least one employee that's that has COVID, but there's about 10-ish right now outbreaks in workplaces. So a lot of that is a lot of effort that goes into case and contact management of every single case to try to prevent spread. If we're able to prevent it in time, although sometimes workers have already infected each other, and then basically when we find out, it's to try to prevent further spread. That's then the type of stuff that we can do and that we continue to do all the time to try to prevent the number of cases from becoming bigger. And when there is an outbreak and there has been spread, then to try to control that spread and stop new cases from coming up. So that's, I would say, the key elements is continuing to, for example, I will give an example, in addition to all the requirements under the framework and the provincial regulations, I issued a letter of instruction to workplaces outlining some of the key areas that I would like them to pay attention to, because these are the key areas of vulnerability that we found in our outbreak investigations, right? Like I had mentioned previously, a lot of times where people let their guard down and where transmission occurs are in those employee-only areas where employees are not distancing, they're not masking, or they're not doing it in a consistent fashion. So it's an area of weakness, for example, that I highlighted in my letter of instruction, as well as, outlining other important things that they can do to try to prevent further spread. And so those are the, examples, I would say, of the activities that we're trying to do to minimize the spread of workplaces. The reason there are a lot of cases and a proportion of these cases become outbreaks is simply because there's so many people, like you said, that continue to have to work. Mm-hmm. And so they, are in workplaces and in schools and, as well as being in social settings potentially. So, that's it.
So I certainly appreciate that. And I understand how much of an uphill battle it is. But if we're going to stop this spread based on these graphs that I've seen over the past number of weeks and the community spread and the influence of the workplaces on this community spread, is there anything that we can do more locally? I would really like to see an action plan. Is there more resources that we need to allocate locally? More enforcement at places of business? Until we put a lid on this community spread that's happening in the workplace, we can talk as much as we want about stay at home, keep your bubble small, and then people still go to work and they catch it and spread it. So it's a mixed message, and I think this criticism is not laying at your door. I know you're doing the best and staff are doing their best. But when we see this community spread happening in workplaces, not only here, but in the rest of the province as well, we need to focus on stopping it in the workplace if we're going to keep those businesses open during the pandemic. And so from my perspective, I think we really need to focus on the workplaces. I'd be happy to have a further discussion about what we can do in the region. If it requires more resources or more enforcement, like this is the only way we're going to solve this. I mean, sick pay is great, but if we can curtail the amount of workplace spread, we won't need as much sick pay. So I know it's somewhat of a rhetorical question, but from my perspective, I would like to see some definitive work around what our action plan is within the region to stop the spread happening at places. And I'll leave that to you to take under advisement. Thank you.
So, Councillor Strickland, I know it's always folly to try to answer a rhetorical question, but I know Best WR engaged the Chambers of Commerce, Waterloo Economic Development, as well as Communitech. So maybe it's something that we can talk to them about, because I think it is more than just enforcement and sort of more eyes on the situation. I think we need buy-in from businesses too. So if you're okay with that, I'll take that as a takeaway.
Madam Chair, I respect that, but I do think it's more than enforcement. I mean, there's whole other aspects to this question. I know in my industry, in the construction industry, we've just started to roll out rapid testing on many construction sites in Metro Toronto right now. And I see construction as one of the areas there. We're 7.8% or whatever the number was. So can we put into place rapid testing in manufacturing facilities? It's got to be voluntary. But there's a bunch of different actions that we can take and we can lead. And I appreciate, having the support of the chamber and so on. But this is a public health matter. And we need to use whatever tools we have at our disposal to stop this spread. And I'll leave it at that. Thank you. I
see Shuli and I see Rod as well. Dr. Wong, do you want to go first?
I'll just make a short comment about rapid testing. So this testing is not under the oversight of local public health. We don't have levers with respect to that, but testing is something that rapid testing in workplaces is an issue that the province is currently, rolling out pilots in across Ontario in select workplaces, and I expect that when they provide an update, the next time they provide an update on that, we'll learn more about their plans for potential expansion of rapid testing in workplaces. It is provincial jurisdiction, a responsibility that's been given to Ontario Health, and it is something where the role of rapid testing has not been assigned to local public health. Although as you may know, the information that he's here locally is something that I continually, keep Ontario Health updated about. And, really it's a provincial issue. What we're seeing here is no different from Al's place in Ontario, like you said. And I just wanted to provide that information about rapid testing and the initiatives underway by the provincial government to pilot that in workplaces. Thank you.
So sure, if it's a quick follow-up. So maybe there's an example, if we have a more fulsome picture of what tools are available and what's happening around trying to contain the spread in workplaces. Like, do we need to advocate for more authority over rapid testing in the workplaces in the region of Waterloo rather than leave it to the province? So that's why I'm really concerned about this, is that, what can we do? What can we advocate for? What tools are at our disposal to stop the spread in the workplace? And I would, Madam Chair, I'd like to see some information come back on that.
Okay, I see Mr. Regier has opened his window. Rod, do you want to speak to this?
Well, yeah, just to mention briefly that we've got a fairly ambitious program that presented to council through the budget process to support businesses in the management of their measures regarding COVID. And one of those initiatives which we're putting forward is a program to certify the COVID safety practices of the enterprise. It's a pretty ambitious program targeting just about every business in the region. So I think there are some pretty significant measures coming forward in the budget process that will at least bolster the work of public health on this front as well.
Thank you for that. Councillor McGarry.
Thank you, through the chair. My question is more on the workplace spread, but I didn't see anything broken down into healthcare facilities. And just wondering if you could give just a quick answer on spread in the workplace that may be attributed to healthcare facilities.
Yes, thanks for the question, Councillor McGarry. So we also see spread in healthcare facilities. It's not on the graph. It's not one of the top ones or the most frequent ones. I just named 5 or 6. But it certainly happens, and it's many times for the same reason. It's employee to employee spread, break rooms, lunch rooms, get-togethers they have, and then it spreads in the workplace in a healthcare setting. Although other healthcare settings where, because for instance, there are a lot of COVID positive patients, for example, there is a greater risk. And we see that, in hospital settings, and of course in long-term care homes, right? There's healthcare workers and residents can be positive, and there can be spread, between residents and healthcare workers. So I would say that overall, healthcare facilities in general, we can see outbreaks in those too, and they're oftentimes based on the same risk factors of, close contact between people who are not really distancing or masking during times when they're often together as employees.
Councillor McGarry, do you have any further questions? Okay, thank you. Councillor Vrbanovic, go ahead.
Thank you very much, and thanks, Dr. Wong, for the great work that you and your team continue to be doing. Just building on Councillor Strickland's points earlier, I do know, for example, in the film industry in Toronto, and I don't know if this is provincially mandated or if it's something the city's done or if it's something the industry itself has done, but they actually, depending on the role that you have in production, this was prior to, obviously, the current shutdown, you were required to either test once or twice a week, and this was done through a private firm, not government testing. And then obviously if the person was found to be COVID positive, then it got shared with public health and so on. I know that from people working in the industry. So I don't know if there's information there that could be relevant to what we're looking at or what we do as we explore in our own region. But I just share that from an information point of view. My question though has to do with discussion or concerns that have been raised locally, and we're seeing it in some other municipalities where the discussion's going on now around sharing the names of companies where there actually is workplace outbreak. I know that we're required to share it in terms of schools and long-term care homes. I know that we've shared it in other limited instances. I know some companies like Loblaws yesterday released a whole list of local stores where there have been incidents. Is this something that we should be revisiting and potentially looking at on our own as well to potentially start sharing those, particularly on maybe not on a first infraction if it's a minor one, but not infraction, but first incident. But if there's multiple ones that happen afterwards, that in fact we do share it.
Oh, thanks for the question. Yeah, I think sometimes what people think is where a workplace has cases is where the risk is, and that's not necessarily the case. Somebody could inadvertently be in the workplace, have spread it, but there's no longer a risk in the workplace versus another workplace that maybe doesn't have a diagnosed case, but someone is actually infectious in that workplace and currently potentially exposing others. So our approach to date, of course, we always continue to look at review data and look at things that we should be doing. But our approach to date has been that, if there's a public health reason to release the location because we think there is an ongoing or there was an elevated risk to the general public or people that we can't identify and reach directly, then we would reveal the name of the workplace. The disclosure has been based on public health management reasons, right? Because there are, inadvertent negative impacts potentially of identifying locations where there isn't an increased risk compared to just walking across the street to the other store. So even if they've had a case, but if the case isn't presenting to the general public or to people that you can't identify an increased risk, then there's no public health grounds necessarily to reveal that versus another business, right? So, to date, that's been the stance we've taken in terms of determining when we would publicly reveal names. So, I definitely understand that even though this, is the approach that most health units have taken as well in terms of what they disclose, it's not necessarily uniform across the province. And so, it's something that, I am looking at in terms of trying to see, what is done elsewhere and for what reasons, and determining whether, it would make sense to revisit any policies based on reasons that balance, a need to protect the public versus, potentially just revealing information because of an interest that people may have, or because people may assume that that is a way that you could actually protect the public when in fact it may not be where the risk is.
Okay, thank you. And lastly, just thanks for the good work on sort of the correlation between workplaces and sick leave. And as Chair Redmond has indicated, Councillor Lawrence and myself will be moving a motion later on in that regards. But a lot of that is based on the great work that you and your team have done in terms of tracking some of that locally. So thank you.
Thanks.
Councillor Shantz, you have the floor.
Thank you. We've talked a lot about workplaces, and we know that the risk is the greatest when we gather together in groups. And so I just wanted to share a quick story. This is my mother-in-law. She passed away in October. We could have had a small gathering then. I think I've forgotten what we could and couldn't have. but we talked about it, and we didn't want to risk another funeral. So we worked together with the pastors and the funeral home, and we live streamed a service that was very nice and meaningful. We had music that had been recorded from previous years from our church. And we had a Zoom meeting afterwards, and we told stories about her, and it wasn't the same as being together, but it was all very lovely, and it was safe. Lots of places of worship are gathering together, have found innovative ways to meet and to worship. And I just want to say thank you to all of those places of worship. Most of our places of worship are doing that. And I know that currently there's a local congregation that's in the news and one in another municipality. And I just hope that people will take to heart the message that gathering together is risky. Even though perhaps there haven't been cases to date, there could be in the future. And I just want to commend the people in the township, in the region, and around the area who have gathered remotely and done it safely. So, yeah, I think that's what I want to say.
Thank you, Councillor Shantz. Councillor Foxton, you have the floor.
Thank you, Madam Chair. Two items, and the first one is again the testing at workplace, and Dr. Wang and I have talked several times on this regard. An employer in the township insists upon testing before they hire a staff member. And now the way I process this right now, and as Dr. Wong explained to me, this is regulated by the province. They are not allowed to be tested. So before, and the employer feels it would be great benefit if they were aware that this individual was clear at the time that they were hired. So I would agree with Councillor Strickland that we try and lobby the government, province, to look into this testing. And especially since we're seeing this happening more readily in the workplaces, this definitely should be the next step, in my opinion. The other thing is that I totally concur with Councillor Shantz. I also attend church virtually by Zoom. I commend all the churches that do so. God isn't just in a building. I believe God is everywhere. And I believe God's with us now as we move forward with this. And in such a way that a building does not make us any better. It's what we do inside and how we care about one another. That makes the difference.
Thank you. Councillor Harris, you have the floor. Michael, you're still on mute. Oh, okay. We'll go to Councillor Jowett and see if Councillor Harris can get off mute. Councillor Jowett, go ahead.
Thank you, Chair Redmond, and I'll be quick. One of the challenges that I've been sort of thinking about is the business-to-business service delivery challenges. Like, for example, we have water bottle services that go from business to business, and we have coveralls, and we have carpets, and we have office supplies, and these are still happening with business to business. And we're hearing so much more about surfaces. And so, again, just another facet to be concerned about, like you don't have enough, Dr. Wong. I just think it's just something to be considered, because, you know, these people are going from one place to another. And I don't know that I think that might be a gap. And what I am hearing is it's the really small businesses that are being a little bit more lax in some of the the social distancing and the mask wearing and the because they think there's so few of them that they don't have anything to worry about. So I also believe that it's time to advocate for rapid testing in the workplace, and I think that it's something that's of critical importance, especially as these cases are escalating at the rate that they are. So I just wanted to put my 2 cents in there and maybe have us consider some of the actual challenges between business to business delivery.
Thank you, Councillor Jowett. Councillor Harris, you're off mute and you have the floor.
Yeah, I am. I actually hung up on myself. So instead of unmute, I just hung up. So thank you, Chair, and thank you, Doctor, for the presentation. Just a couple things. I know there was a question with regards to naming businesses, and I appreciate your answer and clarity on that. I know that, many, in fact, the majority of businesses are doing what they can to keep not only workers safe, but people that may continue to visit their business in an essential basis, and even those that were non-essential prior to the lockdown, doing what they could to keep their business safe. And so I think we are seeing the numbers come in, and it's these, I guess casual gatherings in homes that are obviously the problem, and it's no fault of the businesses, frankly, when people show up to work that may have, who knows what. And so I would not be supportive of naming and shaming businesses. So I appreciate the clarity on that. My only comment, obviously, going forward would be to continue, to see vaccinations coming through. It's clearly a debate between the province and the federal government in terms of the supply. It was disappointing to read, obviously, during the holiday season, a pause on vaccinations when we continue to see numbers go up on the number of deaths, which is sad. I would also add, I'm not sure what else I was going to add, but it just can't come soon enough, right? So thank you to your team again. I know I sit over at the St. Mary's Hospital Board, and we'd like to thank those first frontline folks, not only in our hospitals, but EMS, first responders, grocery store folks, you name it. Thank you for the work that they're doing. And, I'll just pass it on to someone else here. Thank you.
Thank you, Councillor Harris. Councillor Jowett, I don't see your picture, but I see your hand. Did you want to make a comment? Okay, now I see you.
Sorry about that. I'm trying to quickly eat as well. So I'm listening to Councillor Harris, and I understand the empathy towards business, and I certainly have it myself. But as I was kind of sharing some of that information about business to business delivery and people going into small businesses, I'm not excited about shaming business either. But I really do think there has to be some kind of consequence associated in these places so that we don't have to rely on heavy enforcement and heavy bylaws. Like I almost feel like we have to get a message across, especially because there's vulnerability of people who are going into businesses and some folks I've had employees calling me saying, my boss isn't looking after me. And I'll say, well, you have to call public health. But a lot of people are afraid to call in on their employers. So we're dealing with a lot of what we call, I guess, concern for reciprocity. And so I think we almost have to balance that, be somewhere in between. Certainly, I don't like the idea of shaming. I want to be clear about that, but I think we have to set something out there that makes them concerned about not looking after people that are coming in and out of their businesses.
Okay, Dr. Wong, go ahead.
Just quickly, so there is enforcement that does take place on a regular basis, and when a business has been found to not be following the requirements, charges are laid, and every media briefing, every weekly media briefing, Chair Redmond reviews the charges that have been laid by the enforcement partners altogether. So that is a way that the businesses that have not followed the rules and that have had charges laid against them, that is the way that they are named in those instances. I just wanted to let you know that.
Thank you for that, Dr. Wong. Councillor Strickland, do you have another question or comment?
Madam Chair, just with respect to the motion and this conversation that I partly initiated around enforcement and workplace spread and containment thereof, I was just busy trying to craft a resolution, but given that time is of the essence, I'm wondering if it would make sense that we just add on to the current resolution, which unfortunately I don't have in front of me, but something to the effect that, and further, that the region of Waterloo requests the provincial government for increased resources for rapid testing deployment in workplaces and increased workplace enforcement and spot checks by the Ministry of Labor. So then we can at least get it moving. And if the mover and seconder are amenable to that being a friendly, then we'll get on the table and move it forward.
Okay, thank you, Councillor Strickland. So Councillor Vrbanovic and Councillor Rentz, do you want to have the clerk read that back, or how do you feel about adding this to your motion? It can also be dealt with separately if you don't.
I mean, at the end of the day, I'm happy to have us waive notice and deal with it. I just think with the preamble that's there, it's really focused around the whole wage piece and not the other piece, and so it wouldn't really fit at the tail end of this motion. I mean, I leave it up to you, Madam Chair, but I'm thinking maybe best to deal with it as two separate motions.
Okay, so Councillor Strickland, this motion that we've gotten ahead of time that Councillor Vrbanovic and Councillor Rentz are passing actually will be ratified at our January 20th Regional Council meeting. I'm wondering if you can present yours as a notice of motion, and we will deal with it separately and at the January 20th council meeting. Would you be amenable to that?
Absolutely fine with me. Yeah, I'll craft something and get it off tonight.
That's great. So if everybody's amenable to that, we will take that.
Madam Chair, I'm just wondering, sorry for interrupting, but at the end of budget on next week, we'll presumably have a special council meeting anyway. And since these are time sensitive, could we add those to the end of that meeting?
Well, I don't know if Mrs. Fletcher is on the call, but I would say that the special council meeting next week is to deal with other matters. And while I think these could be introduced, I think the budget budget day is not being dealt with on that day, but I'll turn to Mrs. Fletcher. Go ahead.
Oh, okay. Sorry.
So, Chair Redmond, there is a special council meeting on January the 12th. Certainly, we could confirm the one motion that is fully developed today. If it's passed, we could put that onto the special council meeting without a problem. With respect to Councillor Strickland's particular motion, it might be good to introduce it at that time and then confirm it on the 20th following that. And certainly, Councillor Strickland and I would be interested in trying to assist you with respect to the particular motion that you're trying to develop.
Is everybody amenable to that then?
Sorry, Madam Chair. The resolution we're passing tonight is going to be approved on January 20th.
Or we could approve it on January 12th as we have a special council meeting. And so basically it's just a summary that's going to a council meeting that's been passed at Board of Health. And we are currently reviewing whether or not the Board of Health can do those things independently. We've been having some discussion with legal services, and we hope to have that resolved as well. So the next time we have a Board of Health meeting, we have a different process in place.
So Madam Chair, through you, how can I get this proposed resolution approved at the same time on January 12th? Just put it on the table, we waive procedure, and we get it dealt with on the 12th.
So if you can get it to me tonight, Councillor Strickland, we can add it to the special council meeting.
Okay, done. Thank you.
Yeah, I would think the most important thing is that it be circulated and council have time to process it. So these will both be coming forward to special council meeting on January the 12th.
And Councillor Strickland, I'd be happy to second that as well.
Okay, thank you.
So I see no further questions. Dr. Wong, as always, we are in your debt. Thank you and your team for everything you do. And I know CEO Lochner and I see you in action almost on a daily basis as part of the vaccine task force. So there's no end to lots of great work that's being done on behalf of the people of Waterloo region. So thank you. We will now deal with the motion. It has been circulated. Councillor Vrbanovic, if you want to speak to it, and then Councillor Rentz briefly, and then we will vote on it unless there are any questions. Councillor Vrbanovic, do you want to speak to it, or are you happy?
Sure. Yeah. No, absolutely. Thank you, Madam Chair, and I will speak to it and maybe just deal with the operative phrases for the benefit of the viewing audience. And the motion pertains to the issue of sick leave pay and its impact on the issue of COVID in our community. And the operative phrases are that be it resolved that the Board of Health advocate to the Government of Ontario and the Government of Canada to more fully address the need for paid sick time to help address ongoing spread of COVID-19 and the spread of other illnesses in the future, and that this correspondence be sent to the usual list of municipal organizations, both federally and provincially, so that we can advocate on one voice. As part of one voice on behalf of Ontario and Canadian municipal leaders on this issue. And as we know, colleagues, there are programs that have been put in place both provincially and federally to assist those who potentially have to take some time off with respect either being either as a result of self-isolation or as a result of actually being diagnosed with COVID. But these programs generally either simply allow them to stay at home without pay or give them some limited access to funding for an initial incident. But if, for example, you're required to self-isolate a second or a third time, those benefits aren't in place. And that obviously becomes a concern. And if we look at it from a purely statistical point of view, we know that consistently data has shown that some of our most vulnerable citizens are in fact susceptible to COVID-19, and yet they're typically the least able to afford to stay home without pay if they fall ill. And I think we all recognize that this needs to change, and the data that Dr. Wong shared with us today demonstrates that workplaces are our biggest challenge, and the only way we're going to be able to address this, or one of the ways we're going to be able to address this, is by having a paid sick leave program in place. There are others, and Councillor Strickland, as we heard, is going to be bringing a motion forward next week in that regard as well. So I'm pleased to move it, and as you noted, it's seconded by Councillor Rentz, and we'll also be pleased to once we adopt it as a council, also take it to the FCM Big City Mayors Caucus in the weeks ahead.
Thank you. Councillor Rentz, would you like to make some comments as a second?
Yes, I would, Madam Chair. Thank you. And thank you, Councillor Vrbanovic, for bringing this forward. This is a really important issue. And I think a lot of people don't realize how many workers out there don't really have sick leave. In fact, don't really have many benefits. You know, if you work in a unionized environment, it's one thing. When you're out there working for small employers, it's a completely other. So I think people may say, you know, how long and how much can the provincial and federal governments keep doing this? And I would say maybe once every 100 years. You know, I think it's important that the province and the feds step up and look after the working people in this nation. You know, we still need to drive the economy. We still need to have people paying income tax. And if you don't work, you're not doing either of those. So I strongly support this, and I would hope that all members of council will endorse it. Thank you.
So it's been moved and seconded. I see no further questions or comments, so I would ask for the vote. All those in favor, please use your icon, an X if you're not in favor, and raise your hand if you can't find your icon. I'm going down the list. So Councillor Vrbanovic, I don't see you're voting in favor, obviously, because you moved it, right?
Yeah, no, I keep putting the check mark up and then it disappears.
I'm thinking it's unanimous.
Sorry, based on the arrows that have been indicated, I've got 9, but there may be hands that are showing up that I'm just not seeing when I'm looking at the screen.
Okay, so can everybody that's on the screen raise your hand and we'll just double check?
I would say that is unanimous.
Okay, that's great. Thank you.
Madam
Colleagues,
Chair,
yes?
sorry, Madam, the one person I did forget to thank, in addition to Dr. Wong for her work, is Ms. Mendler in your office, who helped in the crafting of the motion, and so I wanted to extend thanks to her as well.
Thank you. Duly noted. So colleagues, that was unanimous, and this will come back next Tuesday at a special council meeting, as well as the motion that Councillor Strickland is putting forward, and that is seconded by Councillor Rentz. Seeing no other business, I would entertain a motion to adjourn. This is moved by Councillor Strickland and seconded by Councillor Jowett. Again, please use your icons. Councillor Armstrong is very excited. He's using his hand too. 2 hands.
That's
Stevie,
carried.
That's carried?
Yes.
Thank you all very much for a very productive meeting. Stay well, and I'll see y'all on Zoom soon.
Take care.
Take
Good
care.
night.